Good afternoon. We're here in San Mateo, California with Ann Curry, who is a patient of Dr. Stacy Close, who had the good fortune of, sounds like, having a successful outcomes of having a maxillary mandibular advancement surgery, which in the acronym is MMA, and we're not talking about fighting. Welcome, Ann.
Thank you very much.
Can you tell us what life was like before you had even a diagnosis, what life was like for you?
Yeah. So what was life like before the diagnosis?
Yeah, yeah. Yeah, obviously you got a diagnosis at a certain point, you went off, and we're going to talk about that journey.
Right.
I want to know what life was like before all this that led up to,
right.
You wanted to that's a major thing to go have that kind of surgery.
Right. Before I was diagnosed, life was really difficult for me because I wasn't sleeping at night. I kept waking up and I wasn't sure why. I went to doctors and they told me it was probably because I just had a baby.
Right.
And so I was waking up a lot in the middle of the night just to take care of the baby.
How was sleeping while you were pregnant? Did you have any gestational diabetes or anything like that?
No, I did not.
So no signs in that regard?
No.
This is all post?
No, I didn't. I mean, I was so sick throughout my pregnancy, but I didn't have sleep problems.
Okay.
At least I don't think I did. But I think that's the symptom with a lot of people is just people present and they don't think that there's anything wrong with them, and they go to doctors and the doctors say, you're a mother of a newborn.
Right.
There's no reason, of course everyone is getting up in the middle of the night. And then I had just started a new job where I was working all the time. And so that compounded my lack of sleep. And then I started having really bad allergies on top of it. I was going into anaphylaxis, and my allergies were just off the charts.
What kind of allergies were you having?
I initially went to my allergist and I found out that I was allergic to all kinds of environmental allergens, as well as, I was allergic to rats. I mean, pretty much you name it that's in the environment, I'm allergic to it. And so...
And I assume your allergist is Dr. Anita Carmen Choi?
Correct. Yeah.
Tell us about Dr. Choi and what that experience was like for you.
Right. So I initially went to her because she was recommended to me from an ear doctor, and I was having lots of ear problems.
Right.
And so I went to see her, and she took the whole panel of allergies, and she is very thorough, very thorough. And of course, I was allergic to everything.
Right.
And she said, well, we'll start on allergy shots, but there's something more going on here. You're not just tired. And I said, well, I'm tired. Everybody says it's a newborn baby, it's a new job. And she said, I think you have sleep apnea. And I knew it ran in my family, but I thought, well, I'm 40 and I'm of perfect weight. There's no reason I should have sleep apnea, because sleep apnea is a disease of older men that are heavy set, and I absolutely do not have sleep apnea. And so I started on allergy shots, and I just wasn't getting better. And
so you were in denial that you had sleep apnea, even from Dr. Choi telling you that?
Absolutely.
Who in your family had sleep apnea?
My father has sleep apnea, yeah.
Do you remember him as a child snoring?
I do, quite a bit. And then later in life, I remember him getting a sleep apnea machine.
Yeah.
But it was pretty considerable. Like, we asked my husband, do I snore? And he didn't notice me snoring. So that to me was evidence right there, I don't have sleep apnea. And then as the allergy testing and the allergy medication process kind of started, and then it realized that I was an outlier, that the medicine that I was getting wasn't working, and I was considerably just getting worse and worse and worse.
Did
and
Dr. Choi ever explain to you the correlation of your allergies and your immune system and why you were having such a hard time because of the sleep?
She did, and you'd think because I have a scientific background, I would have really thought about it a little bit more, but I was so ingrained in the idea that I didn't fit the profile of sleep apnea.
Well, tell us about your background. We don't need to know the particulars, as far as anything.
No. I have a background in molecular biology, okay. And I was working in the lab one day, and I found out that, I was working in the lab one day, and I couldn't breathe, and I went into anaphylaxis, and so I almost died in the lab, and so I found out I was allergic to rats at a really kind of early on in my career, and so it stopped my career in science, and I moved into a different area.
Wow.
Yeah. So I have a lot of allergies, and so when Anita started treating me and I wasn't getting any better, that was tipping off a tipping off point for her, realizing that I had something more going on.
What was it, once you sort of got out of that denial phase, that's not apnea,
Yeah.
you know, I'm still having bad reactions from these allergy meds, I'm a so-called outlier.
Yeah.
What was her next recommendation, or what was your next step in your journey?
Well, I think it was when I really started deteriorating at work. You know, I think when my son started getting a little bit older and I wasn't waking up so much in the middle of the night for him, I was waking up more in the middle of the night because I couldn't breathe. And I wasn't sure then at that point, the allergies had gotten so bad that I would go to the park with my son and I'd have to immediately come home and take a shower and wash all the particulate matter off of me. My husband would have to take a shower, my son would have to take a shower. We were constantly washing the sheets to make sure there was no particulate matter. We ripped the carpets out of our house. So we had kind of done everything we could, and I was still waking up in the middle of the night telling my husband that if I raised my hand in 1 minute, it meant to call the ambulance. So it had just gotten to such a point that I couldn't continue living on like that. And I realized that really at that point, the only thing that was a possibility in front of me is to just get the sleep study and at least eliminate that possibility. What I thought was eliminate the possibility of sleep apnea and move on to something else.
So you thought you were going in for the sleep study. I don't have it. I don't snore. I'm not obese. I'm not a big white male. Even though my dad has it, and there's we now know that there's this runs in families because we all have the same faces.
Yeah.
And we pass it on to our generations. I'm a father of a patient. Will was a father of a patient. His children are now being treated in their 20s, but he wishes at the same thing. So we like to say is, as they say on an airplane, you put your mask on first and you help others around you, whether it's the mask or whatever the intervention is you need. So that if your dad has it, you have it. We should, eventually, and I'm sure Dr. Quo would talk to you about this, is we need to talk about your child.
Yeah.
But that's further on down this conversation. So you're on your road. You now need to go get a sleep study. So what next? Where do you go?
Well, I went to Stanford, and I got in, and I remember they hooked me up with all the machines, and they said, well, when do you usually go to bed? And I said, I could go to bed right now. Why don't you just hook me up? And they said, well, okay, we'll hook you up. And I remember I thought I got a better sleep than I normally did. And then, I had a meeting at 5 a.m., so they didn't have to wake me up. I was awake for hours, and they just said, they looked at my profile, and they said, yeah, you definitely have a problem. And I said, well, I want to see the data. I need the proof. And so I saw the proof, and it was clear that I had sleep apnea.
Who was your attending doctor at Stanford?
Well, initially, it was just through my allergist. It was through Anita Choi, Dr. Anita Choi. And so she was the one that scheduled for me to get a sleep test through Stanford. And then I went back through her, and then she referred me over to Stacy Quo and to Casey Lee.
Okay. Did Stanford try to give you CPAP, or did they try the oral appliances and all the other?
I went straight to CPAP, and then I spoke with a doctor after using it. What I thought I was really compliant with using it, but after using it for a few months, one of the physicians at Stanford said, you're just really not a good candidate for sleep apnea, even though you're super compliant. Really, the best option for you is MMA surgery. So that was, at that point, I kind of stopped and took a breath and started thinking about that.
How many years back did you have this surgery?
It was about 5 years. Well, actually, let me think about that. The whole process started about 5 years ago, and I had the surgery about 3 years ago.
Okay, so you're 3 years post recovery.
Yeah.
How many years before the surgery with all the allergy stuff? What was that window?
It was about an
between your having your baby and
let's see. Well, maybe let's start with 5 years ago. I went to the allergist and found out all the allergy issues and allergy shots. And then about a year later, I started on the sleep study. And then a year later after that, I was in braces. And having surgery.
You want to tell us about surgery?
Yeah, and surgery, I think the most difficult part was making the decision to have surgery, because at that point, my son was about 3, and if the math is going back correctly, he was about 3, and I had at this point, the company that I was working for had gotten really successful, and there was just not a lot of people to take my place to when I went out on disability. So it was an issue of, okay, how do we find coverage for my son at work? He's 3 and he has special needs. So how are we going to do that? And then how am I going to cover at work while I'm on disability? And so my husband and I really sat down and really gave this some serious thought, because in this kind of situation, you get really stuck into thinking about the short-term solutions and not thinking about long-term outcomes. And so we had to start thinking, okay, if I don't get the surgery, what does our life as a family look like? And with me deteriorating and waking up in the middle of the night, having these episodes, it was just, and everyone taking showers all the time and washing clothes, it was just not something that was doable for us for the long term.
Do you have all the encasings and the HEPA filters?
We have everything. We have everything. It's just the environment.
Do you remember your initial sleep study, what your scores were, or any of the numbers? Or?
No, I don't.
We could ask Stacy.
Yeah, I mean, I can provide it to you, actually.
It would be cool. Have you ever had a follow-up post-study after the surgery?
I did not.
It would be really interesting to see where you're at and how much they really theoretically cured and how much you still have as far as residual.
It would be, I think that's where insurance kicks in. You know, I mean, we paid a significant amount of money out of pocket for the surgery. And so did we want to pay
for another sleep study?
For another sleep study, when really, you know, I can feel the benefit, but I can appreciate for research and for other people, it would have been really helpful for me to get that done.
And here's where our job as an advocacy association, the insurance should have not only required it, but requested it, and it should have been covered because it was treatment to cure. You actually did an intervention to cure apnea that they now need to go back and validate that intervention actually worked. So they should cover it. It shouldn't cost you nothing. So it might be 3 years later, now you might have to go pay your deductible. So different story. So just a little bit of an education from that standpoint. What is life like for you now that you've had this surgery, you're 3 years post-out? How has your life changed for the better?
Yeah. Well, I think one thing I don't think people really recognize is after surgery, it's not that you just wake up from surgery and you feel better immediately.
Like that?
Correct. You have.
Tell us what it was like for you.
I had a significant amount of sleep debt to get through. And I think once I got through the sleep debt, life was really different too, because I had never experienced REM sleep, so I'd never really dreamt before. And so the whole process of dreaming and waking up from a dream at night was just completely new to me. And the dreams, it was so difficult because the dreams were so vivid. And so it really kind of affected me a little bit emotionally when I woke up. I had to give myself a little bit of time to kind of get used to the fact that, you know, you're having this completely different life going on while you're sleeping because you're dreaming. And then I also had compounding problems because when my jaw was moved, it was moved into a completely new position that my teeth weren't lining up. So I was still on liquid diet for about a year and worked with a dentist and to try to build up my teeth and to build up crowns so I could chew again. And so eating soft food for that long also takes a toll on your personal life when you go out to dinner, your work life when they order in food for lunches, and you're constantly looking around for soft food. So that went on for at least a year, and I don't think people recognize that.
And weight wasn't an issue for you.
Weight was never an issue. But it also gets tough when you're, you know, when you start the surgery at a normal weight, you know, because of these differences in food and you're eating liquid diet, you don't get the nutrition that you need. So, I mean, my hair was falling out. You know, I was seeing significant health problems. So in the year afterwards, I really had to change all my habits to eating healthy food and trying to learn how to chew again and using my muscles in their new places. So it was really a difficult ongoing process for me, and it's just been recently where I would say I'm officially done with worrying about what I'm eating. I don't go and look at a menu now and see I just need to eat soft food anymore.
Right.
And I don't have to worry about allergies. My allergies, while I still have allergies, my allergies are nowhere near as severe as they were before.
What are you using, what are you treating your allergies with, or besides just avoidance?
Well, let me say, when I first started with the process of my allergies, I was getting 4 shots 4 times a week for my allergies, so pretty considerable time investment. Yeah. And so now I get shots for my things maybe 2 or 3 shots every 4 weeks. So, I mean, that from a quality of life standpoint is considerable. And then, I'll take Sensimist every day, every other day. So it's been such a huge change.
You feel like your quality of life and the time you're able to spend with your child, you said you had a special needs child.
Yeah, I think the thing I've really seen change is I used to be a big runner and do marathons in my 20s and 30s. And that stopped at a certain point because I was really having problems breathing, I thought, because of the allergies.
Let me ask you this. Do you ever get a runner's high?
Did I used to?
Yeah.
I did.
You did?
Yeah.
Even with having apnea?
Mm-hmm.
Wow. Because I used to run 6-minute miles, but it'd take me forever to recover.
Oh, really?
Yeah. Because my mouth was so small, I couldn't breathe.
Well, as I into my late 30s, then I was having problems breathing, and I really had to stop running. And I think at that point, I did stop getting a runner's high. Right. So I think that there's something about getting older, but I think when I really fell off the cliff is after I had my son. And I think that there's something about childbirth, something about, this is my personal experience, but something changed after I had my son with my sleep, because my sleep wasn't as bad before I had my son.
Have you ever had any work done on your eyes, or did they?
I'm blind in one eye.
Okay,
so
that's what I want to ask.
Yeah.
For a long time, or is that?
Yeah, since birth. So it had nothing to do with sleep apnea.
Wow. So my first red flag was I had lazy eyes, I had strabismus.
Oh, I had that surgery, yeah.
Right, so I had the surgery when I was 13, but my eyes, I started wearing bifocals and everything, but what we've learned is nobody really has strabismus. If the brain's not getting oxygen, it's a neurological, so these things are coming out as a result of it.
Interesting. I haven't heard that.
I know. That's why we're having a patient-to-patient conversation. I share what I learned, you're sharing. I've never had MMA. Will actually had a UPP surgery by Casey Lee, but in 2000?
Yeah.
Yeah, about 13 years earlier.
Yeah.
Casey Lee and Dr. Gimeno wouldn't operate on him today.
Oh, really?
Because that's how much they learned who the right person was and who was the right to operate on.
Interesting.
So.
I think the other thing I just want to kind of say, just in terms of people with allergies, I think what they had to do to get me prepared for the surgery was pretty considerable, because you get your mouth bandaged shut. And so not only did they have to do really heavy duty with all the allergy shots and everything, there was another drug that they gave me that I wish I remembered the name of it, but it's an injectable, and it's about $2,000 a shot. And they had to do that to kind of keep me kind of together so I wouldn't go into anaphylaxis during the surgery.
During the surgery?
Well, in the weeks preceding and the weeks after.
Do you have your feeling here? Did you get it all back?
I did. It took a while, yeah, but I do.
So at what point post-recovery, liquid diet, were you out of your bed and then able to start to eat, actually maybe move your jaw, move your mouth, talk?
Yeah, I tried to go back to work about 4 weeks after surgery, and I realized that was impossible. And so I did it at 6 weeks, and at 6 weeks I was still eating a liquid diet and still having a lot of problems talking. I could talk, but it was almost like I had to relearn how to talk.
Yeah, it's muscles.
Yeah.
So are you doing myofunctional therapy at all with Stacy, or?
I was doing it with Samantha. I think
Samantha Weaver.
For a while, but I did it right after the surgery, and I realized it was too hard. I wasn't prepared for how much pain I was in. So, but now, here it is a few years later, after they've built up my teeth into the right positions, I'm pain-free. Nice. But it took a long time.
And no TMJ, no. Wow, no headaches.
No.
Amazing.
No.
You guys have any questions
Well,
for Ann?
she made a comment to me, and I just thought I'd throw it out.
Mm-hmm.
It's like that surgery changes your appearance, and so she was talking about how that was hard to get used to.
Oh yeah, your outward going appearance, yeah.
Absolutely.
Yeah. For you personally, or for other people to see you now differently because you look different?
Both. So my appearance changed my appearance changed pretty drastically after surgery. Right. And so when I'm walking through my house, I can see the family photos, and it's so clear which photos were taken before surgery and which ones were taken after.
So you're the true epitome of a before and after.
Absolutely. Just even looking in the mirror, for women, how you put on your makeup,
right.
Everything is different now. I mean, I remember my hairdresser saying, the way you cut your hair is different now. I mean, because the way your face shape is. For women, so much of appearance and primping is face shape.
I have to applaud you. I mean, for the age you're at and being a mother and for dealing with anaphylactic, to go through a surgery like that and to come out on the other end is really amazing.
Well, I think the big thing, and it's the hard thing, with other people, I was really lucky that I could pay for a surgeon that does 3 of these a day,
Right.
but I had to pay out of pocket for the entire surgeon fees, which is pretty considerable. I know my insurance wanted me to go to someone, and I'm lucky, they wanted me to go to somebody at Stanford, but I didn't think that they had done these as many as some other people. And if I'm going to do it, you only have one shot on goal for this, and I really wanted to do the right thing.
That's the best line I've heard yet.
Okay.
'Cause I'm a soccer guy.
Oh, really? Oh, wow.
I can't imagine you've got to have a question here. Something that
I'm just listening. It's fantastic and terrible at the same time. Fantastic because you're super educated, you're an empowered patient, you found the right doctor, you decided where to go, and you have the ability to pay.
That is where I was really lucky.
The
I was
majority
really
of
lucky.
people don't have the ability to pay, and the majority of people don't have, and the ability to be empowered patients the way you are. I think the majority of people also don't have.
if I didn't come from a family of means, I would have been dead or in prison a long time ago.
Yeah.
Well, I was lucky the company that I was working for and working all these hours for hit it big on a cancer drug, so I was very lucky that money went straight into the surgery.
You might want to talk to him about what that drug is.
For prostate cancer, it was Xtandi. It ended up being a really great drug for people, even that had failed chemotherapy. So I was very lucky that it all hit at the same time, and we made the investment in the surgery.
So you're still working in the...
Well, the company got bought out by
Okay.
Pfizer, so now for the last couple of years, to be honest, I've been continuing on this path of really recovery, because the recovery really is considerable. I mean, for a long time, I couldn't eat normal food, and so now it's been trying to learn how to rebreathe, because my breathing, I never used to breathe. Like when people say take a deep breath, I didn't really understand why that would relax you. And so now I really understand when you take a deep breath, why it relaxes you. And so I've been doing different classes, relearning how to breathe and getting back into exercising. And now exercising when I run is very different than how I ran before, because I realized when I used to run, I would hold my breath.
Wow.
And so, that was a big load on my heart. So now kind of relearning to exercise, relearning how to eat, because there's a whole new scope of foods that are available to me. And now really just taking care of cleaning up my health and making sure I'm in the best health possible for the next phase of my life.
Were you told before the surgery that the recovery would be so time-consuming and so difficult?
I think that the surgeon did a terrific job of preparing me for how difficult the surgery and the aftermath would be. I think that that's why my husband and I really took time to consider the pros and cons of the surgery, because there's so many issues that can come up as a result of the surgery. But it's just, you just have to really take your time and think about what the possibilities are and go forward with it. But I think what we didn't really realize is how bad I was. I don't think I ever realized how bad or how considerable this
Disease.
how sleep apnea had really impacted my life, because I just thought that everybody wakes up in the middle of the night. Everybody has difficulty running. Everybody has, issues at work that keep them up at night. And I don't think I'd realized how much I was trying to make up for that with my health issues.
So I don't know what you're doing going forward in the sleep apnea space, but we would love to have you working with us, part of us, doing something more if you want, are so inclined. I'm so happy that you came and did this.
Yeah, thank you.
Because your story is absolutely...
Well, I got to believe so many people have such similar stories.
They do, but you're an exception in that you've made it out on the other end. and went through such a major thing to be able to tell your story. So what I want to do is prevent someone like you from having all those probably 20, 30 years before, even though I know you think in your head it happened post,
Yeah.
but if your father had it,
Yeah, I'm
it was
sure.
your normal, it was your baseline.
Yeah.
I didn't know what bad sleep was until I knew what good sleep was. So I want to be able to educate so that we don't have to have these major invasive surgeries, because with children, their bones are still malleable.
Mm-hmm.
My daughter, I bite into an apple now, I have the bite of a 5-year-old. She bites in, her bite's twice as wide,
Oh.
because you can expand it.
Yeah.
And you can do the myofunctional and she's using CPAP and all that. But as she keeps growing, you know, there's a good chance that as she learns to breathe with her nose and not her mouth, that she'll never do this. So to see someone like you who's atypical and an outlier, these are the stories that we need to get out there, because it's not just a big fat man's disease.
Well, that's the thing. I think with women, it's really underrepresented in terms of the news stories and whatnot. So yeah, absolutely. I'm happy to help however I can be of service.
I also think that your experience post-surgery is something, I believe that many people who go through this surgery go with surgeons that are not as forthcoming as the one you chose. And therefore they have a terrible experience afterwards because nobody prepared them for it. So having the ability to read about a real life experience can really tremendously help patients that are going to go through this. Once you are aware of what you should expect, it's much less traumatic.
Yeah. Yeah. Well, thank you very much.
Is there
Thank you.
anything that we didn't ask that you think we should be talking about, or that you'd like to share with public or patients, or?
No, I know I should always take the follow-up question, but I don't have anything more. I think that was great.